Hi, I'm Abigail McAfee. This is my Week 2 Pathophysiology 5-minute presentation. The first thing I'm going to be doing is defining disease. Disease is defined as an acute or chronic illness that a patient or a person experiences throughout their life. This can be due to physical trauma, environmental issues. They can be born with it. It could be something in their genetics that happens to them. So it can be anywhere between a common flu or to spinal bifida. Different types of things, stroke, all different types of stuff can go into that category. There's two different types of classifications of diseases. There's congenital, which means that you're born with it. So this can be something that is in that person's gene that they can't necessarily help. A great example of that is spinal bifida. It's not necessarily anything that the baby was exposed to outside. It was more of genetics and genes. The mom could have been using drugs and alcohol during early pregnancy and not known, and this can affect the baby in long terms. The other type is acquired, and a great example of that is just a common flu. Different environmental things that cause that. Also, just the same, chemicals can cause different types of diseases. Your environment that you're in every day can cause different types of diseases. Any physical trauma can cause diseases, just anything that you're exposed to in the world. There's also etiology, which etiology is the cause of the disease. So bacteria is a great example of bacteria. Any physical trauma such as burns, radiation, chemicals that you're exposed to, any biological or physical agent that can, and this can also be your genes. Which you commonly don't think about always as diseases, but if your mom had AIDS or HIV whenever you were born, you're most likely born with it as well. That's also another great example of the congenital. It's not something that the baby itself did. It's something that the mom was already exposed to and carried on into the baby due to genes. Pathogenesis is the pathway of it. Explain how the disease process from where it started, how it began, how it developed, what causes it, what happened, and what the ending of it is. Next, we have symptom. And symptom is something that if I'm experiencing a headache or body aches with a common flu, I would tell my doctor that I was experiencing that. That's something that I, as a subject, explain to them. A sign of a disease is something that the observer themselves can see. So just example, if a nurse, I go into the doctor's office complaining of body aches, that's my symptom. I feel cold, I have chills, but she sees that I'm pale, I look very sick, and then she also sees that she takes my temperature and she says that I have a fever. That's a sign. A syndrome is all of the combinations of the signs and symptoms that a patient or person is experiencing. These are all their complaints, and the characteristics are to a certain thing. Just as I have a certain syndrome as patellofemoral syndrome, which means that I have pain in my knee due to my femur and my patella, and that's a complaint of my signs and symptoms together, and that's what the syndrome is. A complication is something that can go either throughout the disease or with the treatment. It's an outcome due to that. Is it possible adverse extension? So it's something that, a complication with any type of chemo or radiation is that a complication with chemo especially is that you will get sick and you can have hair loss. That is a complication with it. Yes, chemo is amazing to help you with cancer, but you also have certain different things that come out and can affect the person in the way that they are. A diagnosis is just as you went into the doctor's complaining of a body ache, they see your signs and your symptoms, and they do a test. Your diagnosis, you have the flu, which is a big thing right now. And everyone, it's just the nature of the disease. They look at everything, and this is what you have. This is what they diagnose you with. Like I said, this can be as low as strep throat, which you can cure in 48 hours with some antibiotics, all the way to cancer, to spinal bifida, with a child if they come in and they're showing these certain signs and symptoms of spinal bifida, and most of the time this is already seen at birth, then they will diagnose them with spinal bifida. the prognosis is a probable outcome of it. You know, people always talk about with cancer, how's your prognosis? We don't ask that really about a flu, but if you think about it, your prognosis with the flu, normally they say take this antibiotic, you should be feeling better within 48 to 72 hours. If not, come back and we'll do something else. We'll do some further stuff if it's just a common flu. But with cancer, normally we say, you know, what's your prognosis? Do they think with surgery this can be removed? With chemo, with radiation, how is your possible outcome and recovery from this surgery? Or with this disease, excuse me. Diagnostic media is different ways that they help you diagnose and that they're holding standards to. We have certain things that are what we hold our standards to of being able to diagnose somebody, just as diagnosing them with a flu. They have certain signs, symptoms, diagnostic, certain steps that they follow to make sure that our diagnosis is correct. Thank you, and I hope you have a great week.